Say one.
Good.
Okay. Hello everyone, this is Darcy Palmer here. There has been a lot of chatter about the GV20 injection site for dogs, so that's what we're going to demonstrate today. So this is GV20 Governing Vessel 20. That is actually an acupuncture site that is right on top of a dog's head, right about here. So when we give this injection, we're not actually stimulating the acupuncture site per se, we're just depositing the drugs right around that GV20 spot. So how we find that location is if you feel the ridges of the eyes and where they come together in a point, that is right around where GV20 is. And so what I do is pinch the skin and then I just give the injection right there. So the alpha-2 agonists, there are a couple studies now out there showing that the alpha-2 agonists and combined with opioids work really well at this site. So what's the advantage? Well, it takes dexmedetomidine about 15 to 20 minutes to take full effect. At the GV20 site, when you give dexmedetomidine with or without an opioid, it's going to take effect in about 4 to 6 minutes. So the onset time is much, much greater. You can use regular IM dosages at the GV20, or you can reduce the dosage and go back to like your IV dosing. That also works to produce pretty profound sedation. The new drug Zen Alpha that's made by Dechra also works at this GV20 site, and that's what we're going to be sedating Loki with today. So I have a combination of Zen Alpha and butorphanol for him, and we're getting ready to sedate Loki for some pin-hip radiographs. And so we have been doing, this is the injection site that we primarily use for like all of our diagnostic radiographs and things like that. Zen Alpha is a much larger volume because of the medetomidine component in it. And so what we do is use a larger gauge needle. So when I give this injection, I use a 20 gauge needle because when you pinch the skin, you want to immediately give the injection. There's no need to pull back. There's not very many blood vessels there. And if you're in a blood vessel, that's okay as well. But we want to be able to give that injection fairly quickly so that it's not concerning the patient by having too much pressure on the plunger when you're giving that injection. So to give it, all we need to do is have the dog's head restrained. So Dr. Sunarayan is going to show you how he's going to hold the head. So his hands are behind the ear, and that's the only restraint that's needed, which is why this is also a beneficial site for injection, because you don't have to do the full restraint for like an IM injection. All you have to do is hold their ears. It's also important that you don't stand directly in front of them, so we're off to the side, because if you stand directly in front of them, they can get very nervous about why you're standing there. So we're gonna find our injection site. I'm gonna pinch the skin. And now it's also important that you stay very close to the cranium so that you're not actually accidentally sticking the needle straight through the skin and having the drug come out. So we're gonna pinch. Okay, so we're on midline and we're gonna go right close and we're injecting. Okay, so most dogs don't respond at all, just like Loki did. If they are aggressive and they don't like their hind end touched, they don't like their temperature taken, if you put a muzzle on them, that minimal restraint of just holding their ears and scratching really hard while you pinch the skin and give that injection is all that is needed for the restraint. And most dogs, even when they're aggressive, don't even know that you've given them an injection. So that's another benefit to doing this location is the minimal restraint required for it.